Some of my patients who recovered from COVID-19 disease do comes in again with symptoms of prolonged cough. Yeah, so usually I do follow up my COVID patient who have recovered. Yeah, and when they come to me, they often complain that they have this prolonged cough, non-resolving cough, even though they have recovered from COVID. Yeah, so this is what we call organizing pneumonia, which is basically scarring of the lungs that can happen among post-COVID patients who have recovered. Yeah, so basically after you recover from COVID, the lung inflammation should resolve as well by itself. But unfortunately, for some patients, the lung inflammations did not resolve by itself. Yeah. So in this case, if the patient who comes in with organizing pneumonia, in which the lung have scars, due to post-COVID disease, usually they have these symptoms of prolonged cough, and sometimes they can also have shortness of breath as well. Usually the cough is dry cough, and the shortness of breath usually worsen during physical activities or exertions. So usually we have to do some tests. We can start off with a normal chest x-ray. If we see there is some white patch on the chest x-ray, then in order to see the severity of the lung scarring, you need to do a CT thorax, a lung scan, to look in a detail what are the percentage of the lung involvement. Could it be 50%, could it be 25%, or could it be 75%, which indicates the severity of the scarring of the lung post-COVID. Basically, if someone have post-COVID organizing pneumonia or scarring of the lung, we can treat it. We can give steroid tablets. We can also give some inhalers. And we can also give some tablets to help to stabilize the lung inflammation. So basically, this is how our lung looks like. This is a normal lung. So basically, our lung should look pink colored. On the X-ray and CT scan, lung should be black. However, when we do a CT scan or we do a chest X-ray, when we see a lot of white patch, then that indicates that there is a possibility of patients having organizing pneumonia or scarring of the lung post-COVID. So treatment-wise, usually we give steroid in a tapering dose manner. Some people might require longer steroid treatment, for example, a few weeks to few months, depends on the severity of the lung scarring. So basically, those are the things that we will advise. So apart from medication, we will also advise on doing pulmonary rehabilitation or lung exercise, which it may include incentive spirometry, which means that you can do the inhalation and blowing of the spirometer device, which will be given to you. So this lung exercise can help to improve and to further expedite the lung recovery after this lung inflammation.